Hi everyone, I'm Dr. Ayush Jain. I'm a final year internal medicine resident in Sri Balaji Action Medical Institute. If you're watching this video, you're probably confused between choosing or not choosing DNB medicine. My take would be if you are a hardcore medicine person and either you're not getting an MD in your desired college or you're not getting the MD at all, you should strongly consider DNB medicine. Most of you would already be knowing the basic similarities and differences, but I'm still reiterating the more important ones. DNB is also a 3-year course. You have to write your thesis, you write your exams in your final year. Post your DNB, you can write NEET essays like your MD counterparts, and you can choose DM seats after your DNB medicine as well. In most of the institutes, there is no bond, which is a big plus. So earlier, people not getting MD medicine used to choose MD pediatrics, but in the last 3 years or so, this trend has been changing. People are picking up DNB medicine and respiratory medicine as well, more than before. And I think this trend is gonna be there and it is gonna rise only. So I have been part of a video earlier where we talked about DNB medicine in general, but in this particular video, I want to help you choose an institute. So if you have a rank of 4,000, suppose, then in the range of 3 to 6,000, based on last year's round 2 closing ranks, in the cities and states that you are comfortable going, make a list of hospitals. After you have made that list, I want you to go and visit each of those hospitals, because no one can help you make a list. It is you who have to go to these hospitals and see them yourself. Now, when you reach that hospital and you are talking with the resident, often people don't know what to ask. What are the criteria of deciding which institute is good and which institute is not good? So I'll be trying to give you a set of questions that you should be asking these particular residents. Out of these particular criteria, some are more important than the others, which include: first, ask whether you get independent OPD or not. See, OPD is the backbone of a branch, and whether or not you are getting independent OPD, if not from first year, then at least from second year, that is important. In my institute, you get general OPD from second year and EWS OPD from first year as well. Second thing, how independence do you get in your IPD? So suppose you are taking rounds and if you feel that certain investigation is necessary to send, certain antibiotic needs to be added or omitted, do you get independence for that, or are you just walking behind your consultants? So that independence is very important for your learning, and that is something that you should be asking. At this point, I want you to decide which part of spectrum do you want to go. Do you want to go to a core government institute where there will be plenty of patients, there will be huge hands-on, but you will be giving only basic treatment with basic investigations? Versus, do you want to go to a core corporate hospital where there will be all the fancy treatment and investigations available, but probably hands-on will be less? In those institutes, maybe you will have more time to read in the library, but how confidently will you be able to manage sick patients? That is something that you need to figure out. So in this particular spectrum, you can decide to choose institutes which come in between, which are trust hospitals, private hospitals with a lot of government panels where there are a lot of patient load with good hands-on. So this is how I chose my particular institute. Next point that you should be asking is, in your third year, how much time are you getting relieved before your exams? Are you getting time to read in your final year or not? So that is also an important point. Next thing is academics. Academics is a very gray zone. So 90% of the institutes in India, they don't have good academics. Most of the consultants are not concerned about teaching their residents. So at most places, the academic revolves around your seniors and then eventually from books and marrow. So if you can find at least one senior or one consultant in your institute who is happy to teach you, I think that will be good enough. So I think these 4 points were the most important ones: the independence in OPD and IPD, your time to read in your final year, and your academics. If you can find a balance, then I think that's a good place. There are certain more points that I want to add that you should be asking. First thing could be your number of night duties in a month, and whether or not do you get a post duty off. In our institute, first years do 4 to 5 night duties per month, and they do get a post duty off, which is a big plus. Second thing, you need to ask how many residents are there. So try to avoid going to a place where there are only 1 or 2 residents. Try to go to a place where at least there are 3 residents, so your duties can be divided. Next point, always try to choose an institute with a unit based system as compared to a consultant based system. Next point, do ask about departmental toxicity. I get that it's a subjective questions. 2 people from the same institute can give different answers, but at least you should ask once. Next point is procedures. So many of you are very keen to know whether or not will you be able to do procedures or not, how many lumbar punctures, taps or intubations will we do. So please understand that these procedures you will get to learn only if you are able to build your rapport with the ICU staff and intensivist. Then eventually they can hand you over all the procedures. Next point is stipend. So yes, stipend is very important, but in the greed of very high stipend, I don't think you should be going to those government institutes where your learning will be less. Next thing is super speciality. So in our curriculum, we have 1 year of super speciality rotations. The idea is to get an exposure to each branch, because eventually most of us are gonna do DMs in one of these branches. So it is important to have good rotations in your institute. So these were the questions that you should be asking the residents, and based on what you prioritize more, you should be making a priority list for yourself, a preference list for yourself. Please understand one thing, that everybody will have a bias. Everybody will try to justify their decision at their time, that their institute is good and that the branch they have picked is better one. I'm not here trying to sell you this course or my institute or any other institute. It is you who have to personally go to every place and fact check everything, that whether or not you will be comfortable working there or not. And please understand that one of my senior also told me that a known devil is a better than unknown soul. So if you have found a place which you are getting at your rank, where the pros are outweighing the cons, I think you should not be hesitating picking up that branch and that institute. And even after this, if you have any question, I'll be posting down my LinkedIn and my Twitter handle, so you can reach out to me. All the best.